Ladies and gentlemen, let's hear a little bit about one of our sponsors. The Testicular Cancer Conference would simply not have been possible without the support of our generous sponsors such as Fennec Pharmaceuticals. So with that said, let's hear about ototoxicity and what Fennec has to say about it as I turn up my hearing aids right now. Dan Slater is a certified pediatric nurse practitioner with over 25 years of experience in pediatric endocrinology. Prior to that, he worked for 3 years in the pediatric hematology oncology at the University of Iowa as a registered nurse. He joined Fennec Pharma in December of 2023 as a senior medical science liaison. Please put your hands together for Dan Slater.
All right. Thank you very much. So thank you, Kim. Thank you for allowing us to, for the second year in a row, being one of the presenting sponsor for the Testicular Cancer Awareness Foundation. We are really humbled that we are part of this organization and look forward to future years together working more side by side to bring out the awareness. So I wish I had a very fun accent such as our previous speaker. However, I am just a lonely boy from Iowa. So you get the Midwest accent, whichever that may be. So don't worry, this is not going to be a commercial for our product or our products. This is just an education session about hearing loss and ototoxicity. I will be taking questions at the end. So as many of the survivors out here know, there is the lifelong impact of cisplatin induced ototoxicity. For how many survivors in the audience suffer from ototoxicity in some form? Either tinnitus/tinnitus, however you want to pronounce it. All right, so a fair number. So as you guys know, this is a lifelong impact and it does have a tremendous effect on your lives. So for the providers in the office, here's a couple questions for you. How many patients over the span of a year do you see in your clinical practice that have cisplatin-induced ototoxicity? And this is just hypothetical, you don't have to answer, unless you want to. Do you typically include prevention of ototoxicity in your cancer treatment plan? And if so, how do you prevent cisplatin-induced ototoxicity? These are just some questions to think about. So ototoxicity is a very common consequence of cisplatin chemotherapy, which can result in permanent, progressive, and sometimes profoundly life-altering hearing loss. As everyone knows, cisplatin is a very common chemotherapeutic agent that is used as an indispensable component of treatment for common cancers, of which you see listed below, one of which is with germ cell tumors. Approximately 70% of these solid tumors are localized and non-metastatic at the time of diagnosis. Sorry. So we know approximately 500,000 patients are diagnosed in the United States annually that their cancer diagnosis may include some form of platinum compound chemotherapy. 60 to 90% of the patients who undergo treatment with cisplatin may develop hearing loss in their lifetime. And even though we know this, unfortunately, audiological monitoring is very underutilized in the cancer patient before, during, and after treatment. So the level of hearing loss for the cisplatin-induced ototoxicity occurs at the level of the cochlea. So the cochlea is a really small, snail-sized, snail-shaped, fluid-filled organ that begins to harden or ossify at 23 weeks gestation. This is also the time at which the inner ear, so the cochlea is within the inner ear, that it has assumed its the form and the size that it does in adulthood. So we know from this point moving forward, this inner ear stays relatively the same size and shape. We know the outer ear, we know the outer ear obviously changes because it continues to grow with the patient. However, this inner ear stays the same. The fetus begins to hear at 26 weeks gestation. The cochlea contains hair cells that are sensory receptors, also known as the organ of Corti or the spiral ganglion. These hair cells, also known as stereocilia, play a very important role in sending nerve impulses and signals to the brain. So these groups of hair cells are actually tuned to specific frequencies, and the louder a sound, the greater the number of these hair cells that are generated to increase the number of impulses that are sent to the brain. Cisplatin, what it does is it actually creates a reactive oxygen species. These reactive oxygen species destroy these outer hair cells and also create damage to the stria vascularis and the spiral ganglion cells. Once these hair cells are destroyed, they cannot be regenerated or regrown, and therefore this hearing loss is irreversible. So as you know, the effects of cisplatin occur on these cochlear hair cells, and it begins at the base of the cochlea and works its way to the apex with additional exposure to drugs. Cisplatin, unfortunately, like the rest of the body, cannot be, where it can be cleared and flushed within 2 to 3 to 4 hours, it cannot be flushed out of this cochlea, and it retains in there for weeks, months, even years, and may actually never be fully eliminated from the cochlea. We kind of compare this to a swamp in a river. The rest of the body is a nice little river where everything's flushing and clearing, but the cochlea just has this swamp material where the cisplatin just sits and dwells. So unfortunately, the degree of ototoxicity is treatment related. So the higher the dose of cisplatin, the greater the effect of ototoxic may have. However, limiting the dose of cisplatin or changing medications could compromise clinical outcomes. Therefore, you don't want to make these judgments just with a snap decision because it could be dangerous to their clinical outcome. So the signs and symptoms of cisplatin-induced ototoxicity. So tinnitus or tinnitus, I got to do a poll. How many pronounce it tinnitus? All right, how about I do it tinnitus? So there we go. So, and this, as everybody knows, is that annoying, ringing, buzzing, crickets. I've heard it described as mosquitoes in your ear that just kind of never goes away. When you lay in a quiet room, all you hear is this buzzing. Individuals may also develop vertigo, which is a feeling of dizziness or unbalanced. The hearing loss for the sensorineural part begins at the high frequencies, and like I said, this is bilateral, progressive, and irreversible. With continuing exposure, it does progress to the lower frequencies, which is normal speech. This prolonged retention of platinum-based chemotherapy can actually cause hearing loss after treatment has completed. So this is an audiogram of one patient showing across the top, there's a gray line, then there's an orange line, and then a green line you see. So this is actually one patient's audiogram of their left ear. The gray line across the top is showing no ototoxicity prior to any exposure to cisplatin. Then after just one dose of cisplatin, so one dose, one cycle, they received already moderate hearing loss in the normal conversation range. And then after 4 cycles, they actually had severe hearing loss down to the range of any speech. So this is just one particular patient's representation. This is not a representation of all patients who receive cisplatin. So we know that this cisplatin hearing loss lasts forever because the platinum continues to sit in that cochlea, like I said, for weeks, months, even years, and may never be fully eliminated. The prolonged exposure to the platinum-based chemo creates further deterioration of hearing over time. And like I said, it begins at the high frequencies and works its way to the lower frequencies. So this irreversible hearing loss can reduce quality of survivorship. We know that individuals who have hearing loss from their cancer treatment have a statistically significant worse quality of life than their peers who have no hearing loss. It can affect their speech and language skills, their social and emotional development, their career potential, ability to live independently, and if they're still in school, their academic performance. We heard We heard earlier about the emotional and stressful effects of chemotherapy and cancer treatments and cancer diagnosis in its own. So the hearing loss even increases this incidence of depression, anxiety, social isolation, embarrassment, and so low self-esteem. This is a quality of life study. So the bar in blue is showing individuals who have hearing loss who after cancer treatment, and in orange, individuals who have no hearing loss or normal hearing after cancer treatment. And the higher the number, the higher the quality, or the higher the impact on their quality of life. So you can see in these 4 areas, all the individuals with the hearing loss have a greater impact on their quality of life. So even though that we know that these individuals that are at a higher risk for developing hearing loss, unfortunately monitoring is not where it should be, and this audience is probably the best recollection of that, or can recall it the best, where you know your hearing probably wasn't tested before, during, and after your cancer treatments. So this is looking at pediatric studies where there were 72% of patients, only 72% had hearing at their follow-up studies. And of these, only 43% have full audiological monitoring before, during, and after. So unfortunately, and this is according to the International Late Effects Childhood Cancer Guideline, patients should get a baseline and then start planning for their audiological monitoring before they receive that first dose of cisplatin, which should include having their hearing checked before, during, and after treatments include. So the after treatment, it depends on their age. So if they're less than 6, they should have it done annually. If they're 6 to 12, every other year, and over 12, every 5 years. So one patient's recollection said, I would have at least, the very least, liked to have known, hey, you might lose your hearing. Having it told to me would definitely have been helpful, even just mentally preparing myself for something that might happen. So with that, Fennec would just like to again say thank you for allowing us, and this is just a presentation on hearing loss, and we just want to bring it more to the forefront of how much hearing loss does affect individuals who go through cisplatin chemotherapy treatments. Thank you very much for your time.